Have you ever experienced unexplained pain in your abdomen, especially on the right side, and wondered what could be causing it? Or maybe you've been noticing a yellowish tint to your skin, and the doctor mentions something about your gallbladder or liver. If you're in that position, you probably want answers, and you want them fast. That's where the HIDA scan comes in, a test that can help diagnose a range of issues, from gallbladder problems to bile duct blockages. Now, let's break it down. When your liver, gallbladder, or bile ducts aren't working properly, it can feel like your body's plumbing has gone haywire. But how do doctors figure out what's happening inside? They need to see the flow of bile, and that's no easy task. Bile is like a hidden stream, flowing from your liver, through your gallbladder, and into your intestines, helping you digest fats. When something blocks or disrupts that flow, it can cause pain, inflammation, or even more serious issues like jaundice. This is where the HIDA scan comes in. Think of it as a map, helping doctors track that invisible stream. The process begins with a simple injection of a radioactive tracer, which travels through your bloodstream to your liver. It's almost like putting a tracking device on a river to follow its path, except this river is your body's bile system. What is a HIDA scan? A HIDA scan, also known as hepatobiliary scintigraphy or Chala scintigraphy, is a specialized imaging test. Its primary goal? To give doctors a clear picture of how well your liver, gallbladder, bile ducts, and small intestine are working together to move bile. When you go in for the procedure, a small amount of radioactive tracer is injected intravenous. But don't worry, it's completely safe, and the radioactive material used is minimal. From there, a special gamma camera is positioned above your abdomen to take pictures as the tracer moves through your liver, into your gallbladder, and down into your small intestine. Why you might need a HIDA scan? So, why would a doctor order a HIDA scan? Here are a few of the most common reasons. 1. Gallbladder ejection fraction. If your doctor suspects your gallbladder isn't releasing bile properly, a condition known as biliary dyskinesia, they might want to measure the rate at which bile leaves your gallbladder. In simple terms, they want to know if your gallbladder is doing its job or if it's slacking off. 2. Liver function. The scan also checks how well your liver is producing bile and pushing it into your gallbladder. This is crucial in detecting problems early on, before they escalate into bigger health issues. 3. Bile flow. Think of your bile ducts as highways for bile. If there's a blockage or obstruction anywhere along the route, it can cause a backup, leading to pain, jaundice, or even infection. The HIDA scan helps identify where the blockages might be. 4. Post-surgery complications. If you've recently had surgery, such as a liver transplant, the HIDA scan can help determine if everything is healing properly or if there's a bile leak or abnormal connection, known as a fistula, between organs. 5. Diagnosing conditions. In cases of biliary atresia, a rare condition affecting bile ducts in newborns, acute or chronic cholecystitis, inflammation of the gallbladder, or bile duct obstruction, this scan can help pinpoint the problem. Preparing for the HIDA scan. Now, here's where you come in. Before the scan, you'll need to fast for 4 to 12 hours. That may sound intimidating, but think of it like a detective making sure all clues are clear. Eating before the scan could cloud the results, just like smudging fingerprints at a crime scene. However, you might be allowed to drink clear fluids, just double-check with your doctor. There's also something else to keep in mind. If you've had an X-ray recently that involved barium contrast or have taken medications like Pepto-Bismol, let your doctor know. Why? Because barium and bismuth can interfere with the results, making the picture less clear. Pregnant women generally don't get HIDA scans because of the potential risk to the fetus, and breastfeeding moms might be asked to avoid nursing for a few days after the scan. The tracer needs time to exit the body, and doctors don't want any of it passed through breast milk. The procedure. What to expect. Picture this: you're lying comfortably on a table, staying still while a specialist inserts an IV into your arm or hand. It may feel a little cold as the radioactive tracer enters your bloodstream, but that's it. Then, the gamma camera kicks into action, capturing the tracer's journey through your body. For most people, The scan takes about 60 to 90 minutes, but in some cases, it can last up to 4 hours. If your doctor wants to test your gallbladder's ability to release bile, they may give you an extra boost in the form of a hormone called cholecystokinin, CCK. It's like giving your gallbladder a gentle nudge to see how well it empties. Sometimes, morphine might be used to help push the tracer into the gallbladder. If this sounds scary, don't worry, discomfort is usually minimal. And if anything feels off during the scan, always let the staff know. After the scan, what happens next? Once the scan is over, life pretty much goes back to normal. No long recovery times here. Doctors recommend drinking plenty of water to help flush the radioactive tracer from your system through urination and bowel movements. The more water you drink, the faster it leaves your body. What the results mean? Let's talk about results, because that's what you're really waiting for. There are a few possible outcomes. Normal, the tracer flows smoothly from your liver to your gallbladder and into the small intestine, just as it should. In this case, the problem might lie elsewhere, but at least you know your bile system is functioning well. Slow movement, if the tracer moves slowly, it could point to a blockage or poor liver function. Absent tracer in the gallbladder, this can signal acute cholecystitis, inflammation of the gallbladder, which needs immediate attention. Low gallbladder ejection fraction, if your gallbladder isn't releasing enough bile after receiving the CCK hormone, this could indicate chronic cholecystitis or ongoing inflammation. Leaking tracer, if the tracer is found in areas where it shouldn't be, such as other parts of your body, it may suggest a bile leak. The key here is that doctors won't just rely on the HIDA scan alone to make a diagnosis. They'll also consider your symptoms and other test results. Think of the HIDA scan as one piece of a much larger puzzle that helps pinpoint what's wrong. Minimal risks, major insights. The great thing about a HIDA scan is that it's generally safe. But like with any medical procedure, there are a few small risks. Some people might experience an allergic reaction to the medication, slight bruising where the IV was inserted, or a very low dose of radiation exposure. But in most cases, the benefits of the scan far outweigh any of these minor risks. Final thoughts? A HIDA scan is more than just a test, it's a powerful tool that provides crucial insights into the health of your liver, gallbladder, and bile ducts. It gives doctors a clear map to follow and helps them solve some of the trickiest problems in diagnosing abdominal pain, jaundice, and other bile-related issues. If your doctor suggests a HIDA scan, remember, it's a safe, effective way to get the answers you need, and with those answers, you're one step closer to relief. So next time that mysterious pain flares up or your doctor suspects something's off with your gallbladder or liver, you'll know what the HIDA scan is all about, and why it's such a valuable tool.